Hey guys, this is Dr. Hub. Now let's look at the pathogenesis. The pathogenesis and the findings in case of the congestive heart failure. Congestive heart failure. So first, we are going to look at the weakness and the exercise intolerance and the fatigue. So weakness, then comes the exercise intolerance, as well as the presence of fatigue. So what is all of this contributing to? So the causes here are, there is a left ventricular output is inadequate. The left ventricular output, this remains as inadequate to the perfuse muscles. It is inadequate to perfuse the muscles, and especially the failure of output to rise with exercise, especially the failure of the output to rise with the exercise. The next is the ankle and the sacral edema. Why does this occur? Ankle as well as a sacral edema. So this is due to the increase in the PVP. So there is increase in the PVP. PVP stands for the peripheral venous pressure. So peripheral venous pressure, and this causes the increase in the fluid transduction. So this increase in the fluid transduction. Next is the finding of hepatomegaly. So why does the hepatomegaly occur? The hepatomegaly is due to the increased peripheral venous pressure. So there is increase in the peripheral venous pressure, and this increases the resistance to the portal flow. So the resistance is increased in the portal flow. Then comes the pulmonary congestion. So in terms of the pulmonary congestion, there is an increase in the pulmonary venous pressure, and this leads to the pulmonary venous distension. So pulmonary venous distension, and it also as well as transduction. So it leads to the pulmonary venous distension as well as a transduction. This is of fluid into air spaces, of fluid into the air spaces. Then we look at the dyspnea on exertion. So dyspnea on exertion, it is the failure of the left ventricular output. So it is the failure of the left ventricular output, and to rise during exercise. To rise, this is during exercise. Then it increased the pulmonary venous pressure. This increased the pulmonary venous pressure. Next is the paroxysmal dyspnea. Paroxysmal dyspnea. So this paroxysmal dyspnea as well as a pulmonary edema. So paroxysmal dyspnea and the pulmonary edema, they are probably a sudden failure of the left heart. So this leads to the sudden failure. So it means that there is a sudden failure, and it is going to be of the left heart output. So the left heart output to keep up with the right heart output. And due to this, there is an acute rise. So there is a acute rise, and where is this rise? There is acute rise in the pulmonary venous. There is acute rise in terms of the pulmonary venous and the capillary pressure. So there is a pulmonary venous and the capillary pressure. is acute rise, and this leads to a transduction of fluid into air spaces. So it leads to the transduction of fluid into the air spaces. Next we look at the orthopnea. So the orthopnea, there is a normal pooling of blood in the lungs. So there is a normal pooling of blood in lungs, and this is in the supine position. A pooling of blood in the lungs in the supine position, and it is added to already congested pulmonary vascular system. So it is added to the already congested pulmonary vascular system. Then there is a increased venous return. So there is an increased VR. VR is the increased venous return, is not put out by the left ventricle. It is not put by the left ventricle, and that is, it is relieved by sitting up, and raising the head of the bed, as well as lying on extra pillows, Next is the cardiac dilation. So in the cardiac dilation, there is a greater ventricular end diastolic volume. There is a greater ventricular end diastolic volume.